Welcome, everyone. My name is Liz Seaton, and I'm the Policy Director at the National LGBTQ Task Force. And the panel today is LGBTQ Communities, Challenges, and Needs During the COVID-19 Pandemic. I want to thank the Global Public Health Institute and the Institute for the Advanced Studies of the Americas, both at the University of Miami, as well as the International Association of Providers of AIDS Care for sponsoring this conference and this panel today. This particular session is part of the Two Worlds track and will be on for about an hour. We're going to look today at the overall effect COVID-19 has had on the LGBTQ population, both resulting from the virus itself, for which LGBTQ folks may be at more risk due to health factors and socioeconomic issues, and pandemic-related restrictions, all of which, as we know, have caused isolation, loss of economic opportunities, and other challenges for all of the people in our communities. And we have three amazing panelists with us today who are going to help, really talk about and help us understand what is going on with the COVID pandemic and the LGBTQ community. It is true that since the very start of the pandemic, it's been known that the impact of the COVID crisis on LGBTQ people would have a disparate impact. The United Nations, towards the very beginning, in April of 2020, put out a two-page document that outlines the impact of COVID-19 on LGBTI people. And it's called Human Rights at the Heart of the Response. It's part of that series. And it notes that LGBT and intersex individuals may be particularly vulnerable during the pandemic. People living with compromised immune systems, including some persons living with HIV/AIDS, face a greater risk from COVID-19. Homeless persons, a population that includes many LGBTI people, are less able to protect themselves through physical distancing and safe hygiene practices, increasing their exposure to contagion. This affects many different systems and many different aspects of people's lives. It affects access to health services. For example, this says that people regularly experience stigma and discrimination while seeking health services, leading to disparities in the access, quality, and availability of healthcare. There's a deprioritization of required health services, and that is part of the problem too when there's overloaded health systems. We see stigmatization, discrimination, hate speech, and attacks on the LGBTI community. Domestic violence and abuse is a problem. Access to work and livelihood is an issue. And we know also that young people are overrepresented among the homeless populations, at least in the United States. And we also know that people who are forced to earn their living or to survive based on either sex work or other kinds of activities that lead them into the criminal justice system are held in facilities where COVID-19 is an especially large threat. There are some various actions that the United Nations series suggests that states and other stakeholders can take. I'm not going to go into those today, but I do recommend reading this extremely helpful document. What I want to do instead is turn this over to our panelists who have the expertise to really dig right on into this subject based on their own areas of expertise and the part of the Americas from which they hail. So let me start with Jumoke Patrick. Jumoke Patrick is the executive director of the Jamaican Network of Seropositives, which is an NGO in Jamaica that advocates for the rights and concerns of people living with and affected by HIV in Jamaica. He also works with IPAC, which is one of the sponsors of this conference and this session. Patrick's training and work in the social development industry with non-government organizations as well as the public and private sector has been specifically targeted at improving the lives of marginalized communities, especially people living with and affected by HIV, made vulnerable by sociocultural norms, stigma and discrimination, and other development factors. He has managed and coordinated many projects for local and multinational agencies, including the UN Educational, Scientific, and Cultural Organization UNESCO, the USAID, the President's Emergency Plan for AIDS Relief, UN AIDS, and more. Jumoke has done extensive work with the LGBT community, working with the Equality for All Foundation as Health Program Manager. He hosts a wealth of experience, and we're lucky to have him with us today. And so I'm going to turn it over to you now, Jumoke.
Hi, guys. Thank you, Liz, for that introduction, and thank you for having me on this panel. So my presentation today, really, it's a conversation that is guided by a presentation but to set the context or the background where that is concerned, I would assume that my panelists, as well as those participating in this conference, are aware that Jamaica as a Caribbean country still, in terms of human rights, in terms of stigma and discrimination, in terms of issues affecting the LGBTQ community, we have a long way to go. Unlike our sister countries in the global north, we still continue to struggle with policies, we continue to struggle with laws that discriminate against the LGBTQ community in terms of accessing services. Those are still issues that we face as a country here in the Caribbean. So some of these things that we're going to be discussed are not new and not necessarily started with COVID, but COVID would have contributed significantly more to those numbers in terms of access, in terms of treatment and care, in terms of social support services for the LGBTQ community. So I'll start off. Next slide, please. So it's a rapid survey that we did via a SurveyMonkey, and we had 215 respondents. And it happened last year, and based on this slide, our average age of participants, well, majority of the participants were between the ages 18 and 34. And it happened in those urban areas in Jamaica, which is Kingston and St. Andrew, St. Catherine and St. James. Those are the core areas that you may have development more than the other areas in the country where people will go to for employment or reside because of economic opportunities, etc. And those are where the major universities are in Jamaica. The respondent runs across the core groups: gay, lesbian and bisexual men, trans feminine and trans masculine, as well as cis men and cis women. Next slide, please. So this gives a breakdown of the average age that I discussed earlier. And like I said, age 25 to 34 was most of the participant. Next slide, please. Again, this represents the areas: Kingston and St. Andrew, the capital of Jamaica. Most of the respondents were from there. The second city, St. James, had the third highest, and St. Catherine, which is a former capital city of Jamaica, had the second highest. Next slide, please. And this as well gives a breakdown of sexual orientation. And I'm showing this because I want to give an understanding and an overview of that. It runs across the LGBTQ spectrum, whether it's lesbian, gay, bisexual, queer, asexual, pansexual, or however else identify we wanted that to be represented. Next slide, please. I'll skip this one for now. Next slide, please. So to which sub or vulnerable group do you belong? And we recognize that most of the respondents, well, not most, but the second highest represented people living with HIV. And in Jamaica, there is an intersection between being a part of the LGBTQ community, especially men who have sex with men, and the transgender community with HIV. Those communities, in terms of HIV rate in Jamaica, represent the highest infection rate across the community. Transgenders over 50-something%, and the men who have sex with communities over 30-something%. So this survey, this result that you're looking at, kind of gives a clear indication that persons living with HIV persons belong to that group. We also had persons who were either homeless or displaced, identify as sex worker, and then obviously the section in purple represent those who didn't belong to any of those communities. Next slide, please. So we asked, where did you get your COVID updates? To select all the answers that people would select. So traditional media and the government social media pages were the top two in this context. And we are happy that persons are getting their information through these mediums, because there are misinformation out there. There are the different channels, social media, Facebook, Instagram, wherever, whomever you're paying attention to, you're getting the information from those areas. So it was a heartening feeling to know that people were getting their actual information through the core agencies and core mediums, so where people should access information related to COVID-19. Next slide, please. Do you know what procedures to follow if you think you came in contact with somebody with the virus and are experiencing symptoms? And over 95% of the respondents said yes, and a little less, and a little less than 5% said they didn't know. Next slide, please. How has COVID-19 impacted you financially, socially, mentally, and emotionally? Well, has COVID-19? Almost 88% of the respondents said, yes, COVID-19 impacted me in one of these 4 areas as it relates to being a member of the LGBTQ community. Next slide, please. So this gives a breakdown of the impact of COVID-19 on the LGBTQ community based on the rapid survey that was done. 45.32% were unable to access social services here in Jamaica. Just to say as well that social services here in Jamaica are not wide scale or not enough or is in any way significant that is helping those communities that are marginalized, those communities that are disenfranchised. And so if we're seeing that 45% are impacted or affected by this, then this is a significant indication that our community needs more support. If I should read across the diagram, you'll see that 24% became unemployed because of COVID-19. And if you know about Jamaica, we rely heavily on tourism. And once the borders were closed, once the airlines were not taking people across the borders, across the waters to our country, then we'll have an issue where tourism is concerned, and tourism is one of the main financial income for the country, and so that affected the community. Cannot afford to pay rent, so a lot of persons had to move out of their homes or move out of their apartment because no employment leads to no income to pay rent, etc. Unable to buy groceries, basic food items, unable to access healthcare services, unable to freely travel within parishes, within Jamaica because of no income, forced to live with their family. So a lot of LGBT persons would have moved out of their homes because of stigma and discrimination, because their family find out about their sexual orientation and had to move out. But because of COVID-19, the restrictions, the financial issues, they had to move in with their family. And that also adds another layer to the issues that they were facing. And it's also, people said they became more vulnerable as well because of COVID-19. Next slide, please. So what health-related support or services were you accessing before COVID-19? Almost 20% said they were accessing mental health and counseling therapy. 3% hormone replacement therapy. HIV treatment and care was 13.5%. Treatment for hypertension, diabetes, etc. was close to 7%, and 64% indicated that this question was not applicable for them. Next slide, please. So what are the other support services that you were accessing before COVID-19? Persons were getting care packages, persons were being referred to agencies, organizations, including NGOs or government agencies for services, assistance in accessing government support, reporting of human rights violations. Those were the issues that people were accessing before COVID-19 came in February 2020. Next slide, please. Do you still have access to these services and support that you were accessing before the COVID-19 outbreak? 16% said not at all, they're not accessing. 11, close to 12% said yes, they're still accessing, and 13% yes, but limited as to what they were accessing before. Yeah, next slide, please. So what are the reasons why you no longer access these services and support? Reduced income, service providers, having issues with service providers, difficulty reaching those places that would provide these services and support, isolation, and isolation was an issue as well. And then again, so the thing is, these all link back to income generating activities, not being able to have money, not being able to have a job to go to these places that are providing these social support or support in general that they would want as persons of the LGBT community. Next slide, please. What types of support do you need right now in this moment when you're answering this survey? What type of support you need? 20% wanted care packages, basic food items to support their nutritional health. That was one thing that persons required. Access to medical care and medication for persons, that was something. Someone to talk to, mental and emotional health, not having anyone to talk to, living with families that are unsupportive of the lifestyle that they live, unsupportive of their identity, unsupportive of them just being who they are as individuals of the LGBT community. Needing to talk to somebody about strategies to cope during COVID-19. Those were the top issues. And when COVID came in Jamaica, it came as a surprise or a shock. We didn't know what to do. There was a reactive reaction, if I should call it that, where we were just running up and down like headless chicken, not sure what to do, locking down places, all of this, because we were in panic mode and we were uncertain. And one could understand what was happening in the country and in the world at the time. And because of this, the community, like everybody else, was affected. The thing about it as well, as a community that is already disenfranchised, as a community that is already stigmatized and discriminated against, a community that is seen to not have any rights, a community that wherever they go, whatever they do, they're always being watched, they're always being ridiculed. These are not surprised. This is not surprising that their responses, as it relates to what type of support they will need, is like this. When we conducted this survey. Next slide, please. Do you know about the government care program? So just a little bit of background about this. The government recognized a few months into COVID that they should provide social support. And it's similar to what I'm assuming was done in the United States, where the government supported persons who were in need based on unemployment, etc. We tried that here in Jamaica. And so persons say, yes, majority, 51% said they knew about it. 16% said they didn't know about it. And the rest said, yes, but I don't know all the details of the program. And that program in Jamaica kind of went nowhere because those who were actually supposed to receive it were the ones not receiving it. And because of that, it created chaos and problems. And so that had to stop after a while. Next slide, please. Have you applied for the care program, the We Care program? 28% said yes. I want to, but don't know how, almost 12%. And some said, no, I do not qualify. And it was applicable for some persons who didn't need the support. Next slide, please. Will you need assistance to apply for the care program? And we asked this question because we wanted to support, Equality for All wanted to support the community in terms of accessing those programs, accessing those services, because as an NGO, they were unable to provide for the community on a whole scale as it relates to ensuring that the community is okay. So linking persons, making referral, linkages to those service providers that are able to help the community was important to the organization. Next slide, please. What do you think we can do to better support you during this difficult time? And what you're seeing on screen is just really most or some of the answers that were given. Persons need support, persons need care packages, persons just need help and online support to talk to people, friends, assistants, counseling, access to those services that will make them live, will make them survive, and friendly spaces that exist within, whether it's government or the private sector or NGO spaces, that they can continue to survive during this time of COVID-19 as members of the LGBTQ community. And that's my final slide, but I'll end with this. We will forever continue to have these challenges in Jamaica when it comes to access to services, when it comes to justice, when it comes to stigma and discrimination, and when it comes to just mere survival for some persons of the LGBTQ community here in Jamaica. We are yet to be at a place where there are a respecting of human rights, one, but also nowhere near to the government putting systems, putting policies, putting laws in place to protect the community, holding persons accountable, especially service providers, for providing those services for the LGBTQ community, especially those that access healthcare services, especially those persons that have regular issue as the everyday regular man. And so for us as a country, we continue to struggle with human rights. We continue to struggle for recognition for the LGBT community. And as a person of the LGBT community, while I may have a job, while I may be privileged to an extent to survive and to have my own home, there are many other LGBTQ persons out there who don't have anything, who don't have any support. And so outside of the NGOs that are providing the services here in Jamaica, there are no other opportunity. And so we continue to fight, and I would say fight because in our context, it's really fighting for recognition. It's really fighting for basic human rights. It's really fighting to live. It's really fighting to stay in your home. It's really fighting to stay in your job if somebody should find out if you're from the LGBTQ community. So we continue to have those struggles, those issues, but we continue to stand, we continue to partner, we continue to find opportunities for the LGBT community to survive. And especially during this time of COVID-19, we continue to seek out opportunities so that we can continue to support the community. And I'll stop there for now. Thank you.
Jumoke, that was an excellent presentation. And I think that the community in Jamaica is extremely lucky to have you as a strong advocate on their behalf. So thank you for everything you are doing there and for, bringing this information forward. And yeah, I think some of the things that you're talking about what people need and what people have. And I do want to just go back for one moment and acknowledge that although my organization is the National LGBTQ Task Force, I did not say that means the nation I'm speaking about here is the United States, and that there are many other nations affected by this pandemic and the COVID pandemic laid over on top of the HIV pandemic, right? Which continues to challenge us in so many different ways. To the north of us is Canada here, since I'm located in the United States. And a longtime advocate, one of my heroes on this continent, is Helen Kennedy, Executive Director of EGAL Canada. She's dedicated her life and work to improving the lives of LGBTQ Two-Spirit people in Canada and around the world. In 2007, with 22 years of experience in politics, that she became the executive director. Her organizations make significant contribution towards equality through research initiatives, which reveal the current state of inclusion, with education programs to shift to the culture of inclusion, and through legal advocacy to move the needle on inclusion in Canadian society more broadly. She was a founding member of Canadians for Equal Marriage, and Canada, as we all know, became the fourth country in the world to legalize same-sex marriage. I'll simply note that I myself got married to my longtime partner in Canada. Was grateful for the opportunity and all of your work there, Helen. Internationally, Helen plays a large role As former co-secretary general of ILGA, a worldwide federation of 1,500 member organizations campaigning for LGBTI rights, she's also the recent recipient of the Lifetime Achievement Award at Start Proud's 2018 Leaders to Be Proud of Awards. So Helen, let me just turn this over to you now to tell us what's happening up where it's snowy.
Yeah, thanks a lot, Liz. I appreciate it. And great presentation, Jumoke. I really enjoyed it. And hello from sunny Toronto, right downtown Toronto. I just want to acknowledge that Toronto is on the traditional territory of many nations, including the Mississaugas of the Credit, the Chippewa, the Haudenosaunee, and the Wendat people, and that we are mere settlers on this land. And so, next slide, please. EGAL undertook 2 studies with respect to COVID. We did one initially shortly after the crisis started in March of last year. And then we followed that study with another second phase of the same study with pretty much the same questions to see how our LGBTQI2S communities were doing since the onset of the virus. We partnered with an organization called Innovative, and they are a leading research firm here in Canada. And we were very grateful to be able to be participants in some of their research and to add some questions to our own curiosity around the impacts on the LGBTQI2S communities. And our acronym is slightly different in that we use 2S, and that denotes the Two-Spirit Indigenous Aboriginal communities here in Canada. So I just want to highlight that. Next slide, please. So the key findings we found from our second survey that Canada's LGBTQI2S community continues to be disproportionately impacted financially by COVID. The effects of COVID-19 continue to take a bigger toll on the physical and mental well-being of our LGBTQI2S communities, that our communities are more likely to know someone who has experienced or sought treatment for COVID, and that COVID continues to have a greater impact on the employment of members of our LGBTQI2S communities. Next slide, please. And this is, I'll very quickly go through this. This is just an overview of how we did the research, when we did the research, the sample. We did about 2,300 folks who participated in the survey. Next slide, please. And the demographics, you can see from this slide, the gender, the age, and the region. And if you look, the purple denotes the LGBTQI2S respondents, and the gray is the national average response. So you can see, for example, with gender, that 56% of women, queer women, responded to our survey. That the average age of the respondents from the queer community was 18 to 34, not unlike Jumoke, and then various regions of the country that had higher numbers than others for obvious reasons. Next slide, please. Actually, I have a slide missing, but what we did find from our demographics is that more members of the LGBTQI2S community identify as Indigenous, or what we would term mostly racialized, but in this case it's visible minorities is the way the question was phrased. So I can pop that slide in later, but we did get a breakdown, and we do have results based on indigeneity and racialized communities as well. Next slide. Sorry, no, you keep that one there and I'll go back to that. So a large proportion of LGBTQI2S workers are employed in the arts and entertainment. And as we all know, that those sectors were severely impacted by by COVID, and large-scale unemployment within those areas has also had an incredibly negative impact on the LGBTQI2S community from the arts and entertainment sectors. Next slide, please. Oh, okay. So more members of the LGBTQI community identify as Indigenous. This is the slide I was talking about earlier. And you can see that the national average of respondents, 80% identified as white and 20 BIPOC. And then from the LGBTQI2S folks, 71% identified as white and 29% identified as BIPOC. That's Black, Indigenous, people of color. And what we like to do is put Indigenous separate, but the general term that is globally used is BIPOC. But here in Canada, I and my team, we like to put Indigenous first because Indigenous people were here before anybody else. Next slide, please. So the health and safety. So we ask questions around physical and mental health, stress, and the LGBT community reports worse conditions compared to national results. And also those who identify as BIPOC within the LGBT community are more likely to have admitted themselves or known others to be admitted to hospital for suspected COVID. Next slide, please. So members of the BIPOC LGBTQI2S community are most likely to be living with health conditions or disabilities. And this is a really interesting response. You will see that health conditions that leave me more vulnerable than most people to respiratory disease, such as pneumonia or the flu. And 40% of LGBT BIPOC people responded to that question. 36% of BIPOC people said they had a physical disability, and 35 of the BIPOC folks who responded said that they had a mental disability. Next slide, please. So LGBTQI2S folks report worse stress, physical and mental health than the average Canadian. And then again, we broke it down, physical health, mental health, and stress. And you can see from these slides how folks compare the national average versus BIPOC LGBTQI2S folks, for example, and also the LGBTQI2S community more broadly. And I'm not going to go through each one of these because I'm conscious of time, but I'm more than happy to make these slides available to folks who are keen to see this particular breakdown. Next slide, please. And here we looked at healthcare confidence and what is our community's confidence in healthcare providers particularly. And the BIPOC and LGBTQI2S groups, they're slightly less confident that they could get the healthcare that they need. And again, if you look at the national average compared to the BIPOC community, for example, these are really stark findings. And so it's something that we need to look at, how racialized communities within the LGBT community are struggling with COVID and the impacts of COVID, and how the broader LGBTI community may not be open necessarily to assisting or providing assistance or have the resources to provide the assistance that BIPOC members of our communities need. Next slide, please. And so here we look at life satisfaction. Members of the LGBTQI2S community are less satisfied with their lives as a whole right now, and there's a myriad of reasons for that. Unemployment, housing, access to housing, being trapped, as Jumoke mentioned in his presentation, with family members or in an environment that isn't open to who you are or your identity. And so there is obviously a huge impact on our community's mental health. Next slide, please. And so the LGBTIQS community is more likely to know someone who's experienced symptoms or sought medical treatment. And so I'm not going to spend too much time on this slide, but you can also see from the BIPOC community what the averages are there, and they are quite startling. Next slide, please. BIPOC LGBTQI2S community members are more likely to have admitted themselves or known others admitted or suspected of COVID. Again, harsh realities for racialized members of the LGBTQI2S communities. Next slide, please. This one is attitudes. LGBTQI2S community members are more concerned about COVID resurgence, with a net agreement of plus 82 points versus the national average of 81. And so, you know, this is really interesting as well. And I think a lot of this has to go back to the impact of HIV and AIDS and the impact of HIV and AIDS on our communities and how it decimated the queer community back through the 80s and 90s. And so we have a heightened awareness of what epidemics and pandemics do to members of our marginalized, racialized groups within our LGBTQI2S populations. Next slide, please. Job interaction. Here again, we see that the BIPOC LGBTQI2S communities are more likely to work in jobs that require face-to-face interaction. And so then their risks are heightened yet again to exposure. And so these are areas that we need to pay close attention to when we're looking to provide frontline workers with the services and the care that they need to address these issues. Next slide, please. Transportation. LGBTQI2S community members are more likely to commute to work using models of public transit that require greater interaction with the public. And again, higher rates of BIPOC folk accessing public transit than the national average. Next slide, please. Safe work conditions during COVID are pretty much the same between the LGBTQI2S community and the national average. Next slide, please. The BIPOC, as I mentioned, community members report feeling slightly more unsafe in terms of contracting COVID while commuting. Next slide, please. And now we've just focused a little bit on personal finances and jobs. And I'm realizing I'm running out of time here. Next slide, please. Finance confidence, tracking financial confidence amongst the LGBT community has spiked since we first started tracking in March. And I'm not going to break down all of these issues, but when you don't have a job, you don't have confidence that you're going to be able to get a job, when your whole sector is in lockdown and you don't have access to work or employment subsidy programs, then your financial confidence obviously is going to have a huge impact on how you live and how you feel. Next slide, please. And again, the LGBTQI2S folks report a greater lack of confidence in current financials within the BIPOC communities. And there's some really, 25% of BIPOC folks are not very confident at all about their ability to be financially stable. Next slide, please. And job prospects again. How are you feeling about will you be able to get a job after COVID? And again, compared to what we tracked in March, it's not looking great for members of our communities at all. Next slide, please. And then the LGBTQI2S community have a lower net agreement when asked about finding a new job due to greater intensity of those that disagree. So I mean, there's some really good stats here that I'm more than happy to share with everybody. But moving along to the next slide, please. Impacts of COVID on mental health, household finances, etc. Next slide. And I'm going to skip through this, but tracking the perceived mental health impacts have spiked by 5 points since we did the survey in March. Next slide. The BIPOC community, again, report an even greater negative impact on their physical health than the LGBTQI2S average. Next slide, please. The negative impacts of COVID on the mental health of LGBTQI2S folks spikes by 21 points from the national average. And again, if you look at the orange column, you can see the impact on the BIPOC LGBTQI2S members. Next slide, please. And finances and quality of life. Again, you can see the negative impact, and the BIPOC communities, again, are much more impacted than the broader LGBTQI2S community, and certainly than the national average. Next slide. And then we looked at the respondents' similar impact since we started the survey in March, and I'm going to skip this one actually and go to the next slide. Layoffs, again, the BIPOC community, the impact of employment and being laid off is pretty clear and evident in this slide as well. But members of our LGBT communities are at higher risks of layoffs than the national average. And then my final slide, next slide, please, is the financial worry. And the Indigenous and Black people of color LGBT community members report being most worried about being able to pay their mortgage or rent. And the next slide, please. And that is the impact. And it's, I'm sorry to bombard people with all of the numbers, but these numbers and this data is incredibly important for us as organizations to convince our governments that, in fact, there needs to be more effort and more financial resources put into the frontline services when addressing the impacts of COVID on members of the LGBTQI2S communities. And even though in Canada it's a fantastic country in terms of our legal wins and some of our legislative wins, we have to shift the culture, and shifting the culture is sometimes very difficult. And we still have huge amounts of homophobia, transphobia, and biphobia in this country. And these pieces won't change until we shift that culture to align it with our legal wins. And so I'm very grateful to have had this opportunity to participate in this conversation, and I'm looking forward to hearing from the HRC on this topic. So thanks a lot, Liz.
Sure, great. Thanks so much, Helen. Our next speaker is Alphonso David, who is president of the Human Rights Campaign here in this country. He's the first civil rights lawyer and first person of color to be president of the Human Rights Campaign in the organization's nearly 40-year history. He brings significant litigation and management experience in public, private, and non-for-profit sectors. He's been at the forefront of the movement for LGBTQ equality for more than a decade. Formerly, he was appointed by New York Governor Andrew Cuomo to serve as counsel to the governor. Before that, he served for 4 years in the governor's cabinet as deputy secretary and counsel for civil rights, the first position of its kind in New York. He had several posts in New York, and prior to that worked as a staff attorney at Lambda Legal and Education Defense Fund. I want to give Alphonso as much time as possible, so I'm going to stop right there. But Alphonso, I know that you also have, the Human Rights Campaign has been doing some very important research in this area, so let me turn it right over to you.
Thank you, Liz. Thank you for that introduction. To the conference sponsors, to my colleagues who provided such comprehensive and detailed presentations, these are so critical to understanding these issues. And all those who are watching, hello, and again, thank you for having me. As Liz noted, I'm Alphonso David, and I'm running the largest LGBTQ civil rights organization in the United States and, in fact, around the world. And it is daunting to really think about how COVID-19 is impacting our community. It's hard to believe that it has been just over a year since the beginning of the COVID-19 pandemic. And this has been a year of really incalculable loss, one that has fundamentally transformed the way that we live and the way that we work, one that has shattered millions of families and futures. And this has been a year that has laid bare the fundamental inequities in our systems, in our societies, with the most marginalized people once again paying the heaviest price. You heard it from both of those presentations this morning. LGBTQ people, particularly trans people and LGBTQ people of color, have been disproportionately impacted by COVID-19. LGBTQ Americans are more likely to live in poverty and lack access to adequate medical care, paid medical leave, as well as basic necessities. And LGBTQ people are also more likely to work in jobs that are with more exposure, with higher economic sensitivity to the crisis. Since the start of the pandemic, the Human Rights Campaign has conducted research in partnership with PSB Research to analyze how communities in the United States are being affected. Now, our research makes clear that LGBTQ people, and particularly those who hold multiple marginalized identities, are bearing the significant economic burden of COVID-19. And for LGBTQ people who hold multiply marginalized identities, the repercussions they face are even more severe. Black LGBTQ people, Latinx LGBTQ people, and transgender people face far worse economic and health outcomes because of additional systemic barriers in employment, housing, and healthcare. And because of the virus, we are more likely to have become unemployed. We're far more likely to have our work hours reduced. And we are more likely to have delays in paying rent or bills. Further, LGBTQ elders, those over the age of 50, have had to spend, and those who have really spent their lives enduring systemic inequities, are now facing further isolation and uncertainty. Also, our LGBTQ youth are facing challenges. LGBTQ youth who've lived with daily discrimination across many areas of their lives are now being forced to shelter in sometimes unwelcoming or unsafe homes. LGBTQ people are effectively being left behind. And poor data collection by the federal government means that LGBTQ people are being left out of the national narrative. You heard this from Helen and why it's important for us to do this work and compile the data. Lack of clear data makes it much harder to address our community's needs. And that's why, in addition to conducting the research, the Human Rights Campaign, along with some of our partners, continue to call for a comprehensive data collection from the Centers for Disease Control here in the United States, as well as other federal agencies. And we continue to call on Congress to ensure that our communities who are most impacted are receiving the greatest assistance. Now, equity is really the key here. Equity has to guide all of our responses at every level of government, from the vaccine rollout to economic relief. And while we call on officials to act, we also haven't missed a moment to do what we have to do today to meet the needs of our community, from hosting virtual job fairs for transgender and non-binary people, to crafting policy briefs that lay out how our elders need assistance. We are working in coalitions to educate and to empower. And this summer, in fact, we launched a new initiative called Queer to Stay. And this is a program to support businesses that serve the LGBTQ community with a focus on LGBTQ people of color, particularly the transgender community as well as women. Also, as part of our Transgender Justice Initiative, we launched a new small grants program that is being managed by one of our community partners, Destination Tomorrow. We're also proudly supporting Destination Tomorrow's work, offering one-time rapid response grants to transgender and non-binary people who are in need. And we know that the disproportionate impact of COVID-19, the fact that it's having on our LGBTQ community, it doesn't stop at our borders. You heard this from Helen, you heard this from what's happening in Jamaica as well. So on International Human Rights Day, we launched our first ever global small grants program, which is supporting 20 initiatives in 17 countries. We've also joined forces with 10 Partnership for Refugees, and that initiative is to mobilize businesses in North America to support LGBTQ refugees. We've done all of this, and we're doing more to try to weather the storm, to provide hope, to provide community, to provide healing to LGBTQ people who have been disproportionately impacted by COVID-19. With new leadership in Washington, We're hopeful that the disproportionate impact that the pandemic is having will be swiftly addressed. But we know that much more work is needed to address the fundamental injustices that shape this series of crises to begin with. Racism, transphobia, misogyny, homophobia, these are not simply moral wrongs, they're also public health disasters. And in a time when millions are going hungry, facing eviction, being forced into low-paying jobs, it puts them at even higher risk, and people are being pushed to the brink. So here in the United States, we are working to make sure that we address these issues. And the US itself has been pushed to the brink by predominantly white leaders who are following a system that's already structured in their favor to refuse to believe that the votes of majority districts are actually legitimate. The recent events that all of you probably saw on January 6th have only underscored what so many of us have known all too long, that white supremacy has corrupted our institutions and our systems to its very core. And we cannot continue to achieve justice for our communities and the ultimate survival of democracy without really centering its defeat in our shared work. We have to address white supremacy. The LGBTQ community knows adversity, and that's a fact that we all know all too well. In fact, we've drawn much of our strength and our power from times of great uncertainty, from the blatant discrimination to government indifference, from the AIDS crisis to relentless attacks on who we are and who we love, from bills that attack transgender siblings to regulations that remove protections that have existed for decades. We have seen our fair share of struggle, but in each of these struggles, we have banded together to overcome challenges that have seemed insurmountable. We have harnessed our fear and made it into courage, and our anger, and we forged it into strength and resilience. And we are in a time of great struggle right now. There are many people that are on the street. There are many people that are living in poverty. One of our research studies showed that 1 out of 5 LGBTQ people live in poverty in the United States. 1 out of 5 LGBTQ people haven't been able to see a doctor because they cannot afford one. And in this time of difficulty and great struggle, we have to continue to harness our power, our collective power, to transform our systems so that they can truly serve all of us. And in so doing, I believe that we can actually create a future that liberates all of us. And again, thank you all for having me today. And again, congratulations to my colleagues who I think really gave such fantastic presentations. And Liz, I'll turn it back over to you.
Great. Thanks so much, Alphonso. It will not surprise you in the slightest to know that I agree with everything that you said. And I think what's clear is that the research is essential to getting all of our communities in front of our governments in terms of what it is that is needed across a broad swath of issues, all of which have been named here today. But let me ask you this. The other day I saw a slide from the Biden-Harris administration, which was just last week, that showed that they plan to work on equitable vaccine distribution, and listed in that slide in particular from their communications office, from their White House press briefing, was sexual orientation and gender identity. The LGBTQ communities is one of the communities that will be a focus for ensuring vaccine access over time. So let me just ask this, because I think the next step of this is, I agree with you about all of the disparities, and I think we all share knowledge about those. But I think it would be helpful for people to hear, for each of the countries that we're talking about here, what's the plan for vaccine distribution? Will the communities we're talking about receive the vaccine, and on what time frame? And let me start with you, Jumoke.
Thank you, Liz, for that question. So what I know now is that we are in a block of countries, or a group of countries, that will be receiving support for vaccine. The first batch of vaccine is said to be in the country this month, which is over 100,000. The LGBTQ community definitely is not a priority on that list for the first round of vaccine. And I don't believe there would be any specification or categorizing of LGBT persons as priority for vaccine. because the truth about it, in our country, the LGBTQ community is not a priority in terms of those services. And so grouped in other categories or other communities, that's what will happen with the LGBT community as it relates to vaccine and access to vaccine. We also have to look as well at our country, in terms of vaccination. We probably won't vaccinate the entire country until the end of 2022, hopefully, because of our, I guess, access to resources and funding to like other countries. But for sure, priority now is older persons, priority now is healthcare workers. But I don't foresee, or in the near future, that LGBTQ community will be a priority on the vaccination list. Over.
Great, thank you, Jumoke. Let me ask the same thing of you, Helen.
Yeah, so similar to Jumoke, we've started to roll out the vaccine here in Canada, and priority communities are those in the far north, because they're so isolated and don't have access to the same resources as larger urban centers have. They were prioritizing the healthcare workers, frontline care workers, and seniors. I haven't seen anything that specifically identifies the LGBTQI2S community as being a priority. And I don't anticipate that I will see anything along those lines. It's very much by sector, by age, by need, etc. at the moment. We are in a bit of a quandary at the moment because there is concern at the pace with which the vaccine is being rolled out. It's very, very slow. And obviously with the recent potential restrictions coming out of the EU, we may not be getting our vaccines as quickly as we had hoped. So there's a mad scramble here at the moment to manufacture our own supplies, but that's going to be further down the road and certainly won't be much later into 2021.
Thanks, Helen. I'm going to turn it over to you, Alphonso.
Well, I think that we have some promising news from the Biden administration. In his first week, he issued an executive order that effectively said that all federal agencies have to do a comprehensive review of the resources and the services that they provide to the public and ensure that they're being provided in an equitable way. Joe Biden has basically established federal policy to make sure that federal agencies are really providing services in an equitable way. And what the key here is for me is he included LGBTQ people in the definition of disadvantaged or marginalized groups that have been affected by oppression or discrimination in this country. So all federal agencies, and that would include those that are in the process of vaccine distribution, would be required to ensure that the distribution of vaccines are being done in a way that's equitable and to make sure that LGBTQ people are not left behind.
Great, thanks so much. Yeah, I appreciate it. And I know that actually, I know that in other countries across the Americas, a lot of the issues that we are talking about, I mean, a little bit of research goes a long way on the internet these days, and a lot of the countries that we are talking about across the Americas are people are facing the same kinds of issues in terms of discrimination, bias. There have been a few countries that at one point were trying to have people go out by gender, allowing people to go out by gender on different days, and that had a devastating impact on the transgender communities in those countries because of the enforcement mechanisms. I want to just thank everybody for being on this panel, joining us today, and sharing the information that you have, and for all the work that you're doing advocating for the LGBTQI and Two-Spirit communities. And I just know we have so much more work ahead of us, but I am grateful to be in good company as we do that work going forward, and wish everyone health and safety and all the best for you and your families as well. So thank you.
Thank you, Liz. Well done.
Thank you. Thank you so much.
Bye-bye. Thank you.
Bye.